Hi, this is Tim and Sherry. Today we're talking about malignant hyperthermia. Okay, and that's malignant hyperthermia we don't hear much about, but it can be pretty serious, and the Joint Commission wants our facility to have a good cogent response if somebody should be afflicted with that. Sherry, what is this disease process?
It's an abnormal muscle response secondary to patients who've received volatile anesthetics or succinylcholine, and it can lead to brain damage if left untreated.
Okay, so pretty serious business, pretty rare, I understand.
Yes, 1 in 100,000, I believe.
Okay, but we still got to be ready.
Yes.
And we do have a response, and why don't you tell me about this cart?
So this cart lives in the operating room. All of the operating room personnel and pre-op and PACU are trained on what is in this cart. It's all labeled. It's got all the directions, so it's easy and simple for people to follow, but it does take a lot of people to treat these patients, so we need all hands on deck.
Okay, real good. Now, of course, like everything else, we need to show competencies in training, and who would you expect to be trained and have documentation in how to use this cart and how to respond to this type of patient?
Anybody who works with patients who've had surgery, anesthetics, anybody who's been to the cath lab, in the ER, or the ICU.
Okay, so we would expect those folks to have documented training in their HR folder.
Exactly.
Okay, well, I think that is quite a bit for a pretty rare occurrence, but important in the eyes of the Joint Commission. That's Tim and Sherry with your Joint Commission Tip of the Week.